Hi everyone, let's discuss the clinical anatomy in detail. So starting off, we're going to discuss the cervical vertebrae. So they're saying that the anterior root of the transverse process may sometimes be separate. What is the anterior root? So this is the transverse process as whole. So this is the anterior root and this is the posterior root. Anterior root and the posterior root. Anterior root, posterior root. So there's a high chance that this anterior root might be completely separate. And if it's separate, it then forms a cervical rib of variable size. So the costal element of the seventh cervical vertebra may get enlarged to form a cervical rib. So this is the cervical rib. You can see that it's attached to the seventh vertebrae, which is the prominence vertebrae, and from that arises another rib which attaches to the first rib, right? So yeah, there are three types. There are four types of cervical rib. This is the first type, this is the second type, that's the third type, and this is the fourth type. In the type 1, there's a complete rib that reaches the first rib. Type 2, there's an incomplete rib with one end that doesn't attach to anything. In type 3, there's an incomplete rib that attaches to a fibrous band. And in type 4, there's a short bone that sticks out from the lowest vertebra in the cervical spine. Now, also one more thing about the cervical ribs is that they can compress a nerve or your subclavian artery, and it can cause thoracic outlet syndrome, which can be dangerous without treatment. So here you can see that the cervical, this is the subclavian artery, right? And this is the brachial plexus. So there are high chances if a cervical rib is coming out, it can damage both of these structures. So let me read the lines of the book, which said that the costal element of the seventh cervical vertebra may get enlarged to form a cervical rib. What's a costal element? So costal element of a vertebra is the part of the vertebral arch that develops into a rib in the thoracic region. So in thoracic region, we have this costal element, and that rightfully so develops into the ribs. But in cervical and lumbar region, it forms the part of a transverse process or costal process, which may sometimes develop into a cervical rib. So you can see this is the transverse element. So it has a coastal element, like every thing has a coastal element. So this is the coastal element basically. And in the thoracic vertebra or in the thoracic vertebrae, it will turn into ribs. But in cervical and lumbar, it will turn into transverse process or coastal process. So that's what they're saying, that there are chances that in the seventh cervical vertebrae, this costal element may enlarge and form into or transform into a cervical rib. Now, a cervical rib is an additional rib arising from the seventh vertebrae and usually gets attached to the first rib near the insertion of the scalenus anterior muscle. Now, we know that scalenus anterior is the muscle of the neck, and it originates and then it inserts into the anterior, like the upper superior surface of the first rib, right? So that's what they're saying, that right close to the insertion of scalenus anterior, this rib will also get attached. If the rib is more than 5 centimeter long, it usually displaces the brachial plexus and the subclavian artery upwards. The symptoms are tingling pain along the inner border of the forearm and hand, including weakness or even paralysis of the muscles of the palm. So because brachial plexus supplies sensory sensations to your entire arm and forearm, so there are high chances that it will cause tingling sensation and pain in the inner border of the forearm and hand, including weakness and even paralysis of the muscles of the palm. And then the intervertebral, the next point is that now the next clinical anatomy is that the intervertebral foramina of the cervical vertebrae lie anterior to the joints between the articular processes. What exactly is an vertebral foramen? We don't know about the vertebral foramen, right? So if you look from the superior aspect, you'll see the vertebral foramen, right here. But intervertebral foramen is basically this region. When you look at it from the side view, right, the lateral view, there you'll see the intervertebral foramen. If you see from the top view, you'll see the vertebral foramen. The intervertebral foramen, this is the region, right, and here this is the intervertebral disc. Now what happens is that your spinal cord, it's here. So from the sides, you can clearly get a window eye view of the spinal cord. So this is intervertebral foramen. See, and there's spinal nerves they come out from the intervertebral foramen, and spinal canal entire is going into this, and this is the vertebral foramen from the top view. Now, intervertebral foramina of the cervical vertebrae, they lie anterior to the joints. Now, what does this mean? So these are the joints, right? Inferior articular facet and superior articular facet. That's a joint. So anterior to that lies the intervertebral foramen, and this is a spinal nerve coming out. Now, so the intervertebral foramen of the cervical vertebrae lie anterior to the joints between the articular processes. Arthritic changes in these joints, if occur, cause tiny projections or osteophytes. So there are high chances that the arthritic changes can occur in these joints, and what they'll turn into osteophytes. What are osteophytes? Osteophytes are basically spurs of the bone. So they're basically bone spurs or bony lumps that grow on the bones in the spine or around the joints. They form when a joint or bone has been damaged by arthritis, but do not always cause problems. But they can also mostly cause problems. So these are the spurs, which are basically osteophytes. Bone overgrowth compressing a spinal disc. It should be smooth, but no, there are spurs or osteophytes. Now, they're saying that the osteophytes may press on the anteriorly placed cervical spinal nerves in the foramina, causing pain along the course and distribution of the nerves. So, cervical spinal nerves in the foramina, they can be pressed because of these osteophytes, and it can cause pain. Now, the joints in the lateral part of the adjacent bodies of the cervical vertebrae are called Lashka joints. Now, what are Lashka joints? They're also known as uncovertebral joints. They're small synovial articulations in the cervical spine, only in the cervical spine, specifically between vertebrae C3 and C7. They form where a projection from the vertebral body below. They, fo- they form where a projection from the vertebral body below, called the uncinate process, meets a recess on the vertebral body above. These joints contribute to neck stability and movement while also serving as a potential site for degeneration, leading to symptoms from nerve or vessel compression. Now, here we've seen two new words. One is Lashka joint and the other is the uncinate process. So what exactly is an uncinate process? So here you can see this is the body, vertebral body, right? This is the vertebral body. So on top of the vertebral body, remember in the previous videos I told you about the lips. So these lips are basically uncinate processes. They're basically hook-like. So again, this is the vertebral body. So this is the lip, which is uncinate process, uncus. See, uh, again here, here also you can see this is the vertebral body. That's the uncinate process. This is the vertebral body, and superiorly you can see, and the uncinate process will be here somewhere, lips. So they are basically hook-like bony projections that are found in different locations in the body, most notably on the cervical vertebrae from C3 to C7. And keep in mind that C3 to C7 form Lashka joints at the point of uncinate process. Also, these hook-like processes, uncinate processes, are also found in ethmoid bone in the nasal cavity, or they're also found as small projection from the pancreas. So they're found in three regions in the body. Uncinate processes I'm talking about. Now, what's a Lashka joint? Let's get back to the point. So here you can see this is intervertebral disc, but at the side there's no intervertebral disc. So what's keeping the bone together, the vertebrae together? That's the Lashka joint. So Lashka joint is the lateral part of the adjacent bodies of cervical vertebrae. It's a joint in the lateral part of the adjacent bodies of the cervical vertebrae. The osteophytes commonly occur in these joints. The osteophytes commonly occur in these joints. The cervical nerve roots lying posterior lateral to these joints may be pressed, causing pain along their distribution. The vertebral artery coursing through the foramen transversum. So what was I saying? The vertebral artery coursing through the foramen transversarium lies lateral to the Lashka's joint. The osteophytes of Lashka's joints may cause distortion of the vertebral artery, leading to basilar insufficiency. This may cause vertigo, dizziness, etc. So basically, what they're saying that Lashka joint are the joints which are at the lateral part of the bodies of the vertebrae, and these are common regions of osteophytes. And posterior lateral to this, there's some spinal nerves. There are high chances they can get pressed. Even the arteries, the vertebral artery, or even the vertebral artery can be distorted, because of which vertebral basilar insufficiency can occur. That causes vertigo and dizziness. Prolapse of intervertebral, now moving on, the prolapse of intervertebral disc occurs at the junction. Intervertebral disc can also be prolapsed. It occurs at the junction of different curvatures. So the common site is the lower cervical and upper lumbar vertebral. So lower cervical and upper lumbar. Lower cervical, upper lumbar. So these are basically common points of uh, basically prolapse of intervertebral disc. Common points, right? Now, in cervical region, the disc involved is above or below the sixth cervical vertebrae. The nerve root effects are C6 and C7. There is pain and numbness along the lateral side of the forearm and hand. This may be wasting of muscles of thenar eminence. Now, during judicial hanging, what happens is that the odontoid process usually breaks to hit upon the vital centers in the medulla oblongata. Next is atlas may fuse to the occipital bone. This is called occipitalization of atlas, and this may at times compress the spinal cord, which requires surgical decompression. So you can see that the occipitalization of atlas is atlas assimilation, in which the occipital bone and the atlas, the first cervical vertebrae, they basically assimilate. They merge together. So this can compress the spinal cord. So this needs surgical decompression. The pharyngeal and retropharyngeal inflammation may cause decalcification of atlas vertebrae. This may lead to loosening of the attachments of the transverse ligament, which may eventually yield, causing sudden death from dislocation of dents. As I've already told you, sudden dislocation of dents or fracture of dents, it means that it will break and hit upon the vital centers in the medulla oblongata. Moving on, we are talking about the fractures of the skull, which may be depressed, linear, or basilar. So there are a variety of types. So let's focus on these three. Now, in the linear, this is the depressed, and this is the basilar. So you can see this is depressed. It's so evident here, right? Now, what happens in all of these types? A skull fracture is a bone break in your skull. Your skull is the bone structure that surrounds your brain. This head injury is common after vehicle accidents, falls, and sport injuries. So, vehicle accidents, fall, and sports injuries. Some skull fractures are mild and heal on their own. Others may need surgery to repair your skull, and even complications from affecting your brain. So, they might need surgery. A linear fracture is basically the most common type of fracture. It usually happens in the bone toward the top of your head above your ears. So, that's the linear fracture. Now, talking about the depressed fracture, it's a break in your skull that pushes part of the bone closer to your brain. A depressed fracture can involve multiple cracks and fragments. So this is the depressed fracture. Now talking about the basilar fracture, that's a break of the bones at the base of your skull. This includes the bones behind your face and the bones that are internal in your brain that you can't see. So at the base of the uh, skull. So base of the skull depressed. This moves part of the brain or part of the skull closer to the brain, and this is a linear fracture. So it's the most common. It's basically a line. So that's pretty much it. And finally, hangman's fracture occurs due to fracture of the pedicles of the axis vertebrae, atlas and axis, right? So here we're talking about axis vertebrae. Its pedicles, if they are let's focus on the pedicles. This is the pedicle, right? That's the pedicle. But this is C3. So what about C2? C2 is very you know, yeah, here. So this is the pedicle. Here also, this is the pedicle. So hangman's fracture occurs due to fracture of the pedicle of axis vertebrae. As the vertebral canal gets enlarged, the spinal cord does not get pressed. So that's it about the clinical anatomy.